morning. I am Lyrra from BSN 1C, and today I'm going to perform the physical assessment from head to toe. Before on that, I will be gathering all the equipments that will be needed to ensure to save time and effort. And next is I will be sanitizing my hands using the alcohol to prevent contamination and also the spreading of microorganism. Then, ma'am, good morning, ma'am. I am student nurse for today. So, can I ask what is your name, ma'am?
My name is Lyrra.
And your birthday?
March 9, 2006.
So, thank you, ma'am. So, can you stand here, ma'am? And I'm going to measure your height and weight. Please sit back, ma'am. So next is I will be inspecting your hands for skin surface and for the symmetry. And the next is inspecting the nails for the color, shapes, thickness, cleanliness, and the contour. And the next is palpating the nails for its firmness. And then lastly is assessing the capillary refill. Sorry, thank you, ma'am. So ma'am, next, I'm going to assess your head and face. So first, I'm going to inspect your size, the skin structure, and also the shape and the position of your head. Then next, inspect the hair distribution, the scalp, and also its characteristic and texture. So next is palpate the symmetry and also the skull. And then next, palpate the temporal. So here, temporal artery. The next is to inspect the facial feature for the structure and also for the lesions and facial expressions. So next is inspect the skin color. Then next is palpate the bone structure and the temporomandibular joint. And then assess the range of motion. So ma'am, can you open your mouth? Close, please. Again. Close. So thank you, ma'am. And the next is I will be observing the asymmetry of the patient. So can you smile, ma'am? Can you frown? Can you stick out your tongue? Can you pop out your cheeks? So thank you. The next, so can you close your eyes? And then this is the dull, and this is the sharp. So please tell me, what do you feel? So what is this man?
Dull.
How about this?
Sharp.
How about this?
Dull.
How about this?
Sharp.
So thank you, ma'am. The next, yes, I'm going to assess your eye. So first is the distant, the near, and the peripheral vision. So ma'am, can you stand here please? And then, I'm going to point out the letter, and please tell me what it is. And also rather is, please cover your eyes. So, what is this, ma'am? E T O Z D D, and none in the other side. E F O Z L. Thank you, ma'am. So please sit. So next, stay still covering your eye. So please read this.
The northern countries of Europe scarcely deserve the expense and rigor of conquest, the forest and morasses
So thank you,
of
ma'am.
German were,
And the other side.
filled with a hardy race of barbarian.
So thank you, ma'am. In the next, please focus on this object and follow the movement by using only your eyes. So ma'am, please. Thank you. The next is I will be inspecting your conjunctiva for the color, drainage, and lesion. Thank you. The next is inspecting the cornea, the sclera, the iris, and the pupil size for the transparency and also for surface characteristic. So ma'am. So thank you. And the next is I will be assessing your extracorporeal eye movement in the 6 cardinal. So ma'am, please. So thank you. And the next is the cover and cover test. So please, ma'am. And the other side. Thank you. And the next is to palpate the eyes. The nocturnal puncta. So ma'am, can you feel any pain? Thank you, ma'am. So next is averting your upper eyelids. Next is assessing the cornea reflexes and also inspecting the anterior chamber for the transparency and chamber depth. So here. Ma'am. Straight. Another side. Last. So the next is I will be inspecting your nose. So I will be inspecting the external appearance for its skin surface and also for the color. Also, I will be assessing for the sense of smell. So, ma'am, can you close your eyes and smell this? What is the smell, ma'am? So, that's right. Thank you. And the next is I will be palpating your nose for the tenderness. Do you feel any pain, ma'am? Thank you. The next, I will be inspecting the internal nasal cavity for the discharge. That. And then lastly is to palpate your frontal and maxillary sinuses. So frontal. So ma'am, do you feel any pain? Thank you. And then next is examine your mouth. So I will be inspecting your lips, the color, the symmetry, and the surface. And then next is I will be inspecting your gums. So ma'am, please smile. Thank you. Next is your tongue movement. Can you open your mouth? Can you move your tongue from side to side? Up and down. Thank you. And then next, I will be inspecting your buccal mucosa and anterior, posterior pillars for the color, surface, and the characters. Can you open your mouth, ma'am? On the other side. And the next is I will be palpating your teeth, the gums, for the surface and also for tenderness. So ma'am, and also for your tongue, please. Thank you. Next, is to inspect the ophopharynx for the gag reflex. So ma'am, please open your mouth again. Thank you, ma'am. The next is for the taste. Can you? So what is the taste, ma'am?
Cheesy.
So thank you, that's right. So next is the ears. So I will be assessing your hearing. So ma'am, what is the color of this gloves?
White.
Thank you, ma'am. And then I will be inspecting your internal ear, external rather, for the color and the skin surfaces, for the alignment and intactness and deformities. Next is the external auditory meatus. And then, for the inspect of characteristic of external canal for cerumen and also for the cerumen body. So, next is inspect the tympanic membrane for the contour, the translucent, and fluctuation. So, And then next is assess your auditory function. So, can you hear this, ma'am?
Yes.
The other side.
Yes.
This is the Weber test. And then last is the rhyme test. Next, I will be examining your neck. So first, inspecting the neck position, and also the size, the skin surfaces, and the presence of the masses. So, and then I will be palpating your neck muscle. So, gentle lang, ma'am. For the tone, and also for the pain. So, can you feel any pain, ma'am?
No.
Thank you. And then I will be assessing your neck muscle. So, can you, can you lean your hands on the other side? And then the other side. Thank you, ma'am. The next is I will be palpating your thyroid gland. And also for structure of the trachea, for the presence of nodules. Then next, I'll be palpating also your lymph nodes. So here, for the node sides, and also for the mobility and tenderness. And then next, is I will be testing your shoulder and neck muscle for the strength and movement and the symmetry. So can you sure. Again. Again, ma'am. Thank you, ma'am. And then next is I will be palpating the carotid artery. So here. And auscultate. And lastly is inspecting the jugular veins. Yeah. So next, ma'am, is I will be examining your posterior and lateral chest. So can you stand, please? So I will be inspecting your lateral chest. Yes. For this position, and also for the development of scapular placement. The next is I will be observing the respiratory movement. So can you inhale, ma'am? Exhale. And then I will be inspecting the skin, intactness, and the characteristic. So next is I will be auscultate the posterior and the lateral thoraces. So now, so in the breath now. Inhale, exhale, inhale, exhale. Thank you. So, and the next is I will be palpating the posterior thorax for fremitus and expansion also. So, ma'am, can you see 99?
99.
Again,
99.
again.
99.
So, thank you. Please inhale. 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 Exhale. So thank you. And then, lastly is percuss the kidney for the contravertebral angle plane. So ma'am, can you feel any pain?
No.
So thank you. So can you at rest. So can you forward one? So, inspecting the female breast. So, the patient is seated. First is inspect the breast for the size, the symmetry, and also for the surface, for the color and the venous patterns. So, here. And the next is inspect the areolae for the color, shape, and also for the surface characteristic. Yes. And then next, inspect the nipples for the size, the skin surface here, and also for the in the various position also for the symmetry, contour, and the bilateral palm here. The next is palpate the axilla for the enlarged lymph nodes and nodules here. Next is for the male breast. So first is inspecting the breast for areola, for the nipples here, for its skin surface, and also for the color and the symmetry. And the next is the palpates the breast, the nipples also, for the tenderness and masses. The next is to palpate the axillae for enlarged lymph nodes. So in here. So next is the lower extremities. I'm so sorry. The abdomen rather. So can you man? The abdomen. So are you okay, man? So please can you your hands. So first I will be inspecting the abdomen skin. For the skin color and the surface movements. So, and then auscultate the abdomen for the bowel sound. And palpate slightly the all quadrants of the abdomen. Can you feel any pain, ma'am? So thank you. And then, next, palpate also deeply. So, for the tongues. And for aortic pulsation. So, ma'am, can you feel any pain?
No.
So, thank you. And then, percuss the abdomen for the tongues. And then percuss the liver to determine the span and the descent. So here. And palpates the liver for the border and the pain. So, ma'am, can you feel any pain? Yes. And then palpate the gallbladder for the pain. So, ma'am, can you feel any pain?
No.
And also for the spleen. Next is palpates the inguinal part for the bulges. And also may be indicated the hernia. So, ma'am, can you feel any pain? Thank you. And then, palpates the inguinal lymph nodes for the consistency. And also for the mobility and the tenderness and warmth. And then lastly is palpate the kidney for the contour and pain. So, ma'am, can you feel any pain? Thank you. I will be back. Next is to examine the lower extremities. So I'll be inspecting the knees, the lower legs, and also the feet for the skin surface, and also for the skin color and surface characteristic. So next is to palpate the hips. So ma'am, can you feel any pain? Thank you. And then palpates the lower leg for the temperature. Next is palpates the pulses from the popliteal, the posterior tibial, and the dorsalis pedis. So here, also here, also here. Then next is palpates the knees for contour. The next is assess the capillary refill for the toes. Next is inspect the nail also for its shapes, the contour, the thickness, and the color. So next is palpate for the nails for its firmness. Next is assess the range of motion of the hips. So, ma'am. Next is assess the muscle tone from the upper lower legs, and then assess the muscle strength. So, ma'am. Please. Okay. The next is assess the sensory function. So, ma'am. So, this, can you close your eyes? So, this is the dull, and this is the sharp. So, please tell me what you feel. So, what is this? Again, ma'am.
Sharp.
How about this?
Dull.
How about this?
Sharp.
How about this?
Sharp.
Thank you. Then, ma'am, please stand. And please walk. Then again, ma'am. And then, please sit. So I will be assessing the range of motion of your ankles. So please sit there. So ma'am, can you move your ankles, your feet in a circular motion? Next, and the other side. So thank you. Then I will be assessing it. Next, on the other side. Thank you. And then, please ma'am stand. So I will be inspecting the shoulder and the cervical, thoracic lumbar spine for the alignment and symmetry. The next is inspect the hips for symmetry. So ma'am, can you move your hips? And observe the gait for the conformity, rhythm, and symmetry. Yes. Next is palpates the posterior neck and the spinal process. So here. And paravertebral muscle. So here. So ma'am, can you feel any pain?
No.
Thank you. And then next is I will be assessing the hyperextension of the hips. So, ma'am, can you move your hips from side to side, from front and back? So, thank you. And then is I will be assessing the symmetry and the spine and range of motion of thoracic, lumbar spine, and test for the balance. So ma'am, can you stand with the only one feet? On the other side. So thank you. So ma'am, can you sit? Here. In front, ma'am. For next is I will be examining your genitalia. So the patient is lying in lithomy position with a drape. So first I will be inspecting the pubic hair for or over the skin, and also for the inguinal area. So here. The next is inspect the labia majora here, and the labia minora here, and the clitoris in this part. The next is I will be palpating also the labia majora and labia minora and the clitoris. But before that, so my hands will be done by the gloves. So in inspecting this so next is forgot. Then inspect the urethral meatus, and for the hymen, the vaginal interthorax and perineum for the positioning and the surface in this part. The next is inspect the sacrophageal areas for the surface characteristic, and also palpates it here in this part, and then palpates the skin and the Bartholin glands for the surface discharge and pain. So in this. So next is palpates the vaginal wall here in the opening tone, and inspect the perineal area for the anus and the color and surface characteristic, and assess the anal sphincter in this for the muscle tone, and also for the characteristic of the stool for the presence of the occult of blood. So the patient is resumed for a seated position. So next is the male genitalia. So first is inspecting the pubic hair, and also for its hair distribution, for the surface characteristic, and also palpates the penis for its tenderness here. Next, it inspect the scrotum in this part. Yes. For the characteristic and tenderness. Next is, so while palpates the scrotum of the patient, so the patient is lying on the left side with the right hip and knee flex. Next is inspect the sacroccygeal areas and also palpates it for its tenderness and surface characteristics. In this part. So next is inspect the perineal area for the pigmentation and the surface characteristic here. The next is palpate the anus for the sphincter tone and the anal canal, and also for the surface characteristic in this part also. And examine the stools for the characteristic and the presence of the occult blood. So this part is anal. Then, when the patient is standing, so inspect the inguinal region, so in this, for the femoral area for the ball rest, and palpates the testes, epididymis, and vas deferens for the location and the consistency, and the nodules here. Then next is transilomate the scrotum here for the evidence of the fluid and the masses. And then palpate the inguinal canal for the evidence of direct and indirect hernia. So here. So that's all. Thank you.